Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter M. Today I'm going to talk about a disease called Myasthenia Gravis, which is an autoimmune disease. I'm going to talk details about the mechanism of this disease. Theoretically speaking, it's quite important because it's still quite common after the infections, and it's an overreacted immune system causes the symptoms. Generate antibodies against the body self. So let me just bring up the information about the emergency situation. Is there any clinical signs associated with this myasthenia gravis warrant an emergency visit? Yes, because this disease really is the muscle weakness. And if the muscle weakness, if the muscles involved in the respiratory system, the respiratory muscles, so that will be causing the difficult breathing, that's really dangerous. That's the emergency situation. Feel like the weakness, no air going, or just the breathing is kind of slow and low. So that's the sign to go to the emergency room to get treated immediately, or if it is too late, then intubate to help the breathing. Any conditions associated with myasthenia gravis that you can manage at home? Probably not, because this is even though sometimes the clinical management is depends on the symptoms. Usually need you have to actually not usually have to be managed by the physician. So let me talk about this two emergency situation or the very mild situation managed at home. And this for this myasthenia gravis, you cannot manage at home. Have to be managed by a physician. Even though it's not emergency, have to be managed. To be diagnosed, use different tests and then make sure. Either immunological test for the antibody or the medication trial to test and to confirm the diagnosis and then treat accordingly. So what is this myasthenia gravis? It's a mouthful to say it, especially for me. I want to be frank. It's a foreign accent, and myasthenia gravis. It's difficult to pronounce. But it is a medical term. So it's really referring to a ascending form of the weakness of the muscle caused by the hypersensitivity or overreactive immune functions. If you recall the hypersensitivity or overreactive immune system, there are 4 different types. Type 1, which refers to the acute hemolysis, for example, the acute hemolysis or the anaphylaxis reactions, and the type 2 referring to the not that acute but still the antibody against the body itself, and type 3 is kind of the antibody, antigen, and complement, the deposit. So this type 3 is kind of is not a delay form, but it's relatively chronic compared to the depends on the location, of course. Usually, for example, the kidney or the lung, it's not a 1 day, 2 days process. It's take a little time to develop this deposit on the basement membranes, cause the dysfunction of the organs. And type 4, of course, is the delayed reaction, like the dermatitis or some of the use this as a TB test, for example. So this type 2 hypersensitivity or overreacted immune functions is really referring to the antibody generated either the post-infection after the upper respiratory tract infection, body battling the virus at the same time generated the antibody has the same epitope with our own tissue on the muscle or the neuromuscular junction actually, and then bind it to cause this muscle weakness. Talk about this theoretically. In addition to this hypersensitivity, the theory to explain this hypersensitivity, which means antibody against ourselves, and in terms of location, it's also this location located at the neuromuscular junction. How do I explain it? So we do for example, the muscle have a lot of neural endings. Those endings through the synapse, the nerve endings secrete the neurotransmitters, and then the muscle cells can receive this neurotransmitter, for example acetylcholine, and then to start to function, to contract. So this antibody is against this acetylcholine receptor at the neuromuscular junction. So then the acetylcholine cannot function, so the message cannot pass down. This is the common language to explain, but the location is in the neuromuscular junction. If you imagine this is the example just came to my mind currently. So if the mail, for example, from the somewhere from one post office to the other post office, and then this post office passed to the receiver, and this is the neuromuscular junction is like this. There is the neuromuscular junction, the message or the letter was not passed from this post office to the receiver. So this is what happened. So that's why the muscles start to getting weak, because the no neurotransmitters, no message passing down. You need to contract to maintain the muscle tone. So that's basically this is the mechanism theories to explain this phenomenon. It's just after the respiratory tract infection or after GI tract infection with particularly the Campylobacter, it's kind of bacterial infection, diarrhea causes this kind of ascending like, which means start from lower extremity, gradually the muscle weakness from lower extremity gradually coming up to feel until really if they reach the level of the respiratory muscles, that's the emergency situation. And in terms of the risk factors, really anybody, I do not, probably there's some genetic predisposing factor, but it's really the direct triggering is after the upper respiratory tract infection or the GI bacterial infection, then develop this antibody while battling the bacterial or the viral, and then recognize the own body tissue as the foreign, so attacked it, cause this neuromuscular junction abnormality, so lost the muscle strength, ascending like. So this is about the in general. In terms of the symptoms, really after a couple of weeks after the infection, you start to feel weakness. If you pay attention, the weakness, we usually have the weakness associated with the infection. During the infection time, you feel tired or fatigued because the body battling the viral or bacteria. But this muscle weakness is after probably a couple of weeks, a couple of days after the infection. Feel the weakness and ascending like. Beginning is the lower extremity, and then going up, feel difficulty move your upper extremity or the chest muscles associated with breathing. So in terms of diagnosis, there are different type of diagnosis. Is antibody test or use medication, which is to mimic this acetylcholine, and then to see whether the symptoms improved. So different kind of diagnosis. This is really for the medical professions to prescribe appropriate diagnosis for you. But the take-home message for you to understand is after a couple of weeks after the infection, you feel like the weakness still there, especially from the lower extremity going up, feel weaker and weaker. So then that's probably it's a sign. See your physician. In terms of treatment, there are autoimmune management, manage autoimmune disease when managing this disease. The same or the mimics of the acetylcholine or the hormones to mimic the hormones to produce as exogenous hormones to treat this disease. But this is the information. I think it's quite common. But it's belong to the specialist, of course. And I hope this video helps. But you can search if you're interested for more information. And thank you for watching. I will see you next time.